Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, AuvelityThe vs Wellbutrin, Effectiveness for Depression. Both Auvelity and Wellbutrin are effective for depression, but a small RCT, n=80, reported that Auvelity worked significantly better than Wellbutrin and took less time to start working. 43 people prescribed Auvelity experienced an overall decrease in their Montgomerysberg Depression Rating Scale, MADRS, score of 13.7 points after 6 weeks, compared to a decrease of 8.8 points in the 37 people prescribed bupropion. Leastsquares mean difference equals 4.9, 95% C equals 3.1, minus 6.8. At week 2 and every time point thereafter, significantly larger changes in the MADRS score and remission rates were reported with Auvelity than bupropion, minus 12.5 versus minus 7.8. Leastsquares mean difference equals 4.7, 95% C equals 0.6, minus 8.8. In addition, 60.5% of people taking Auvelity had at least a 50% decrease in their MADRS score at week 6, compared with only 40.5% prescribed bupropion. Leastsquares mean difference equals 19.9%, 95% C equals 1.6, 41. Most other outcomes favored Auvelity. The most common side effects associated with Auvelity were dizziness, nausea, dry mouth, decreased appetite, and anxiety. It was not associated with psychotomimetic effects, hallucinations or delusions, weight gain, or sexual dysfunction. Auvelity is a combination extended-release tablet containing dextromethorphan 45 mg and bupropion 105 mg, and Wellbutrin XL tablets contain 150 mg of bupropion. The addition of dextromethorphan to Auvelity means that it also has a direct effect on the NmethylDaspartate NMDA receptor, because dextromethorphan is an NMDA receptor antagonist. NMDA receptors are located on nerve cells, mostly at excitatory synapses, and research has shown that they can become overstimulated when glutamate levels are high. Previous studies have shown that NMDA receptor antagonists can have antidepressant effects. In Auvelity, the bupropion component has a similar antidepressant effect to that experienced by people taking Wellbutrin, but it also boosts concentrations of dextromethorphan in the blood by competitively inhibiting cytochrome P452D6, an enzyme in the liver that breaks it down. Auvelity is usually given twice a day after an initial titration period, and Wellbutrin XL is usually given once a day. Related questions: how long does it take Wellbutrin XL/SR, bupropion, to work? Does Auvelity work better than Wellbutrin? What medications can help me quit smoking? RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.